My name is Mark Geary. I'm head of communications for Beaumont Health. Thanks for joining us today for a media update. I'm joined with Dr. Nick Gilpin here from Beaumont Health. He's our medical director of infection prevention and epidemiology. Dr. Gilpin wanted to give everyone a brief update on where things stand with COVID numbers at Beaumont and in our community. And then afterwards, he will, of course, answer any questions you have. So I'll turn it over to you, Dr. Gilpin.
Okay, thanks, Mark. As Mark said, my name is Nick Gilpin. I am an infectious disease physician, and I'm also the medical director of infection prevention for the Beaumont Health System, an 8-hospital system in the Metro Detroit area. And I wish I was here under happier circumstances, but unfortunately I'm here because over about the last 4 to 5 days, we've seen a considerable increase in our hospital COVID numbers. And we have currently about 397, almost 400 COVID patients across our hospitals. And the numbers that we're seeing in the community seem to also mirror this. The numbers across the state jumped about 30% in the last week. And the community positivity, the percentage of tests positive in the Tri-County Metro Detroit area has also increased and is now around 11.5%, which signals that we are in a period of substantial to high community COVID transmission. This is more than double the rate that we're seeing across the nation. So Metro Detroit, once again, is becoming a hot spot. And I will start out by saying that just to put some perspective on those numbers that I just mentioned, with around 400 COVID patients in our hospitals right now, I consider this to be our 4th COVID surge. So going back to our very first surge, which was March, April of 2020, so many months ago, we peaked at that time around 1,300 patients. That was by far our most crushing wave. And then several months later in the fall to winter months of 2020, so starting in around November and taking us through January of 21, we peaked at around 700 COVID patients. And then we had a brief period of respite. And then again in the summer, early summer, late spring months around April, May of 21, we peaked at around 800 patients. And that was the wave that was predominantly driven by the new Delta variant. Then we had a period throughout the summertime where numbers were down, community positivity was lower, we were starting to get back to normal, everything felt good. And then for the last couple of months, say starting in about late August, early September, we've been experiencing this slow burn, this slow, steady increase with a very shallow slope of increases in COVID patients in our hospitals. And that number has gone over the last few months, a very slow slope, to in the last week or so, a very sharp increase to where we currently are. So again, we are dealing with a somewhat lower number of COVID patients right now than we've seen in prior surges, but I am very concerned about the trajectory of this new wave. And so why are we experiencing this right now? I have a few possible explanations that I'll share with you. I don't think any of us knows for certain what's driving this. It's probably a combination of things. For starters, it's for certain that we still have a significant proportion of unvaccinated in the community. And we know our own numbers verify this. Numbers across the state of Michigan verify this. This wave is predominantly driven by unvaccinated individuals. And Michigan continues to be a state that has opportunity to vaccinate more people. So that's certainly driving a portion of this. We know that cooler weather that we've been experiencing over the past couple of weeks creates conditions that are more favorable for the virus to transmit, not only because temperature and humidity seem to favor transmission, but also because behaviorally, when it gets cold, we all start to gather indoors again, and that means more opportunity for transmission. And the third piece that I see is across the country, there's been a lot of news reports over the last several weeks that COVID has been in decline. And I think that's true for a lot of regions in the country, and that may even be true holistically for the country, but that's certainly not been our experience here in the Midwest. So I think some signaling that things are starting to get better has led to some more relaxed attitudes. We're seeing relaxed behaviors with regard to masking, physical distancing. We're seeing more and more large gatherings take place. And we know that those are the conditions that are going to make for more transmission. So I wanted to get together with you all today, and I wanted to kind of send up a flag. This is our early warning system. We're seeing community numbers increase. And I think with more cold weather on the way, with people starting to make plans for the holidays to get together, I think it's an important time just to let everyone know that we've got to stay vigilant. We've got to continue to do all those things. There's very little that I can do here from inside of the hospital. This is really a community effort. Now that we're in a period of high transmission, we got to make sure we're wearing those masks. We got to make sure we're taking those precautions. We got to get ourselves vaccinated. Those are the things fundamentally that are going to really improve the situation.
All right, thank you, Dr. Gilpin. One question that I saw that already came in is how many of those individuals in the hospital are vaccinated versus unvaccinated?
So what I'm going to give you is sort of a steady percentage. And what we've seen is that generally around 65 to 70% of all of our COVID patients in the hospital at any given time are unvaccinated. And that holds true for any COVID patient that comes into the hospital. That number is also approximately the same for our ICU patients. So when you look at around 400 patients, we were at, as of yesterday, the last time I looked at these numbers, we had around 260 that were unvaccinated, and we had about 115 or so that were fully vaccinated. So that corresponds to about 30% or so fully vaccinated and about 70% unvaccinated. I can tell you, I've looked at those numbers in more detail. Most of those patients that are coming in that are fully vaccinated, there's usually an explanation for this, right? And the explanation typically is that the person either has chronic medical conditions that put them at greater risk, that mean the vaccine may not be as effective in that population. For example, immune compromising conditions, older age, or these may be people who got vaccinated very early on in the pandemic, and they may be experiencing some waning immunity, which is one of the reasons why the CDC and the FDA have made recommendations for certain populations to get a booster dose. I also think it's important to say, as the proportion of the population, the general population, is increasingly vaccinated, then the proportion of our hospital patients will go up in commensurate fashion. So we'll see more vaccinated people in the hospital with COVID as the amount of people in the community get vaccinated. That's just, it's not a bug, it's a feature. And I don't think that our numbers of vaccinated to unvaccinated patients is out of step with what other healthcare systems in the region and the state and in the country are seeing right now.
Thank you. Another question that I think people have on their mind is about the younger population. I know the vaccine was just made available to another younger group of individuals. What are we seeing in the pediatric population?
So we're seeing that hospitalizations are certainly up across the state in our hospital and other hospitals, and that's for adults, and that's also for the pediatric population. We're also seeing that the largest case increases are happening right now among school-aged kids. That's kids who are between 10 and 18 years old. Much of that is because there's still a significant proportion of that population that is yet to be vaccinated. Remember, we only just recently opened up the opportunity for the 5 to 11-year-olds to get vaccinated. And I sense, anecdotally, and I've seen with my own eyes, that there is still a lot of vaccine hesitancy in that age group. So largest increases among school-age kids. Also, most new case outbreaks of COVID that are happening across the state are happening in schools. And it's not even close. So you've got schools driving a large proportion of outbreaks. Remember, those kids, they may not get very sick from COVID. Some of them will, but they can still catch COVID. They can still spread COVID to others. They can spread COVID to their teachers. They can spread it to their household. And then it just becomes a way for the virus to propagate more. The next highest number of outbreaks that we're seeing across the state is happening within nursing facilities, long-term care facilities. That's not unexpected. That's always been a challenge for us in the public health and in the healthcare sector. And we certainly do our best to mitigate that. But right now, schools do seem to be driving a fair amount of the new cases and new transmission.
Would you like to say anything just about the availability of the vaccine for both children and adults? It seems like you can get it anywhere.
Yeah, thanks, Mark. So I think right now, I would say it's not hard to get a vaccine, right? I mean, there's a lot of places that are offering vaccinations. I know public health sites are standing up vaccine operations. I know big box pharmacies are offering vaccination. Clinics now are outside of hospitals. Many are starting to offer vaccinations. Beaumont Health, the hospital health system that I work for, does have a small amount of slots carved out by appointment for vaccination, but we're not really telling people that they have to come to us or go to one place or another. I think the message is you should get vaccinated and you should go to the place where it's most convenient for you. Like I said, it's just not that difficult to get vaccinated right now.
All right, thank you, Dr. Gilpin. All right, let's open it up to some questions. If you have a question, raise your hand and we'll go from there, or submit it in the chat if you prefer, whatever is easier for you. Kristen.
Thanks, Mark, and thanks, Dr. Gilpin. I have a question about the accessibility of monoclonal antibodies right now, given that we're seeing a big rise in cases. We're seeing a lot of people get sick. How easy is it for people to get monoclonal antibodies? Is there a waiting list? And what is Beaumont doing around monoclonals?
That's a really good question, Kristen. So first of all, I want to just say I'm about a half a step removed from the operations side of the monoclonal antibodies, but I do know a little bit about this, and I can say logistically, the delivery of monoclonals has been a challenge. It's been a resource challenge, not only from do we have enough actual product, but do we have enough staff, space, and infrastructure to deliver monoclonals? That's something we're working on very diligently. We have a team. When a request is generated from a primary care physician or from someone in the community, it gets reviewed by our team of physicians and pharmacists. We make sure that those people meet the qualifications for receiving monoclonals, meaning they have to be not admitted to a hospital, obviously. They have to be at increased risk for severe disease, so they have to have certain medical conditions that place them at higher risk or advanced age. And if they meet those criteria, then we reach out to those patients and we get them scheduled to get monoclonals. I will tell you that a message was sent out to Beaumont physicians in the last 24 hours stating that, yes, we do still continue to have some logistical challenges with this. And so we're encouraging primary care physicians or any physician, if you feel you have a patient that qualifies for monoclonal antibodies, use all resources at your disposal to get those patients. Don't just use Beaumont. I mean, of course, we want you to use our facilities, but by all means, reach out to other healthcare systems in the area. There's a lot of ambulance companies that are delivering monoclonal antibodies. There's a lot of people in the community that are getting more creative to make sure that we can get these products into the right people, because it really does make a difference. The literature really has shown that these monoclonal antibodies are very effective at keeping people out of the hospital. So beg, borrow, steal, that's really been our message. We want to make sure we can get as many people monoclonals as we can.
All right, Drew Armstrong.
Hi, Drew Armstrong from Bloomberg News in New York here. I'm curious if you can speak a little bit about where geographically your patients are coming from, if they're mostly local to the area, or if you guys have been seeing a lot of regional transfers or even out-of-state transfers coming in, and how that's affected your patient census.
Good question. So the vast majority of our patients come from our own primary service area, which is the zip codes immediately surrounding our hospitals. We do, as a tertiary care hospital, we have our large flagship hospital in Royal Oak is about an 1,100 bed tertiary care level 1 trauma center. We do get some referrals from other parts of the state and even outside of the state. But I can tell you that those generally make up a very small proportion of our overall COVID. Those are typically for extraordinary circumstances, very sick patients, patients that may qualify for ECMO or extracorporeal membrane oxygenation, which is a technique to make sure that these patients are getting oxygenated if the ventilator is not doing enough work for the patient. And we have taken a fair number of those, but it doesn't seem to be skewing our overall data. It still seems to be our own primary service area that's driving this.
All right, Kim.
Taking a look back at last year and trying to put this in context with the surge that led to the 3-week pause, how does this compare? And what are your thoughts on mitigation differences? What would you like to see happen?
So this is slower, as I said. You look at those past surges and they were steep ups and steep downs. 2 months, the whole thing would be over from start to finish. And a lot of that was because we were being a little bit more blunt force trauma with some of our mitigation strategies, right? Lockdowns and things of that sort. Now we're in a different position. We have vaccines. We have things in place that we know can flatten that curve effectively without having to necessarily resort to some of those techniques that we've used in the past. What I would like to see personally is I would like to see more people taking common sense approaches, right? We know that there's a lot of COVID in the community. We're getting to a point where we're approaching 10%, which is a very high number. Let's wear masks when we go out in public, not just for COVID, but because there's other things out there too, like flu and RSV and other respiratory viruses that the mask can help mitigate. So wearing masks in public, good idea. Getting vaccinated, right? Good idea. I think we still have, again, a significant proportion of people out there that are unvaccinated or maybe have just gotten 1 dose. I think we start to close that gap. I think we start to see these numbers come down.
And can you go into a little bit more detail about what you're seeing with children in terms of the hospitalizations? Thank you so much.
Of course. So fortunately, and I will say fortunately, pediatric hospitalizations are still a relatively rare occurrence, right? Pediatric deaths of COVID are still a relatively rare occurrence. And that's a good thing, right? I don't want our hospital to fill up with young sick kids if I can avoid it. My concern with the pediatric population in COVID is not that they're going to necessarily overwhelm our hospitals, but certainly some will come to the hospital and some will get sick. It's more what's happening out in the community. When a kid gets sick in a household, the likelihood that mom and dad and brother and sister and whoever else is in that household are going to get sick is astronomically high. And it just becomes another way for this virus to propagate itself.
Okay, Larry.
Hey, doctor, this is Larry Spruill with WDAV here in Michigan, Detroit. I just want to confirm also, did you mention, say it's 11.5 increase? And then my second question would be, are you expecting another surge as it gets into the winter months, another surge after this one?
So Larry, the community positivity rate that I referred to, that I like to track that number because I think it's pretty easy to follow. It's simply the percentage of positive tests in any given community. And typically we break it down by counties, but you can also lump it together with regions. If you go back to the summertime in Metro Detroit, the community positivity, the percentage of positive tests for COVID in our area was very low. It was probably less than 3%, which means that in a situation like that, you can do a lot of things that you otherwise couldn't have done when we were in the middle of a surge because the risk of getting COVID in the community was significantly lower. So around that time, you saw some relaxation around restrictions. We were starting to relax some of the masking behaviors. Now, fast forward to where we are now, that number has gone up to 11.5% in the Metro Detroit area. So last I checked, Macomb was around 12 to 13%. Oakland is around 8-9%. Wayne County is around 5%. So when you put it all together, Metro Detroit is around 11% or so. That's an incredibly high number. For perspective, go back to prior surges, we've seen that number go as high as 20 or 25%. When you get into that situation, everything you do carries risk. And so that's when people need to recognize that number. It's an early warning system. It says the weather outside is bad and there's a lot of COVID, And if I'm going to go out there and do anything, I need to make sure that I'm wearing my mask and taking precautions, maybe stay away from large crowds, maybe prioritize activities where I know the people that I'm going to be mingling with are vaccinated. Those are some simple things that we can do. And I'm sorry, Larry, you asked another question too.
Yes, my second question is, are you expecting another surge after this one as we get further and deeper into the winter months?
I think this is it's shaping up to be a marathon, right? If you look starting back in around late August, we had this very shallow slope, slow rise, and now it's started to kind of take a different trajectory, a much steeper trajectory. I have a feeling we're going to be living in this world probably for the next couple of months and possibly even through the winter. Because again, I don't really see anything out there that's going to stop this in a meaningful way unless, people radically change their behavior, start wearing masks, get vaccinated. Yeah, this fourth surge that we're in right now could shape up to be a 4 or 5 month long affair.
All right, Karen. Karen Vifard, do you have a question? Right.
Sorry, I was having trouble unmuting. Yeah, actually, I had just wanted to ask, more specifically about the children, if you have any children admitted to hospital currently among those 400.
We do, Karen, and I apologize that I don't have the numbers of exact numbers of pediatric patients with COVID that we currently have. And I could probably get that information, but I do know we have some COVID pediatric patients, just not sure how many right now.
Okay, well, if you could get that to me later, I'd appreciate it. Thank you.
Okay.
Can a question in the chat from Deanna Lights at WWJ. She's asking, have we had to postpone or cancel any surgeries or procedures? And I know you also wanted to talk to folks about, if they do have a medical emergency.
Yeah.
That
No,
we're still
thank you.
here.
Deanna, that's a great question. So as you all know, we've been down this road before a time or two. In the early goings, back in March, April 2020, we did have to close down elective surgeries. We did have to restrict access to our hospitals because we were overwhelmed. We're very fortunate, and we have a very dedicated staff. We can still provide those necessary services. I want to make sure that message is crystal clear. We can still take care of you. If you're having chest pain, if you're having stroke symptoms, if you're having a bona fide medical emergency, COVID or non-COVID, you can still come to our hospitals and we will still take care of you. It is very much business as usual. We've lived through now, 3 surges, and we're in our 4th surge right now. I don't like to say we've gotten better at this, but by necessity, we have learned to walk and chew bubblegum at the same time.
Kim, you have another question?
I do, Dr. Gilpin. I was listening to you talk about people who are vaccinated and people who are unvaccinated mingling, and I'm thinking about the holidays. What are your concerns about the holidays, as we have so many families where some people are vaccinated and some are not?
I will say that it's extremely difficult to quantify risk in a meaningful way in these situations. And I've thought a lot about this. Because, I have this situation in my own life, right? Like we all do. I will say this. When we try to calculate risk in these situations, people have to make a risk-benefit judgment of their own. Gathering together with a family of vaccinated people where no one is exhibiting symptoms, that's grade A, right? Gathering together with a mix of people vaccinated and unvaccinated where no one is having any symptoms, that's going to be a little bit riskier. How much riskier? Again, hard for me to know for sure. But as you start sprinkling more and more unvaccinated people into the mix, the risk quantifiably goes up. The concern is that someone could be unknowingly, have COVID. Maybe they're not symptomatic. They could potentially spread it to others. If you go to, say, a concert or a sporting event where there's maybe an even greater number of people that are unvaccinated. Again, those are the situations where I, as a vaccinated individual, may be at lower risk from getting COVID, but that doesn't mean I couldn't still. No vaccine is 100% effective, and we've certainly seen that with COVID. Even in my vaccinated state, I could get COVID. I probably won't end up in the hospital, but that doesn't mean that I might not get sick. that doesn't mean that I might not give COVID to someone else. So I really think going into the holidays, people need to look at that situation themselves very closely, say, what is my risk calculus? What is my appetite for risk? If I am an elderly, immune compromised person with chronic medical conditions, I'm probably going to stay away from a gathering where there's unvaccinated people unless everyone is wearing a mask. Does that answer your question?
All right, Kristen, you have another question?
Yes, thank you. Dr. Gilpin, I wondered if you could detail for us a little bit about how the hospital system is getting through this, given the staffing situation, given the higher volume of patients with other medical conditions who are coming in for care, along with the COVID patients and the increases that you're seeing. I know that you've learned to walk and chew gum at the same time, as you said, but what does that mean for patients? Is there longer wait times in the ER? How is Beaumont handling this?
Well, I'm not going to lie. It's kind of brutal. We're all very much tired of this, and taking care of sick COVID patients is incredibly labor intensive. But we mask up and we gown up and we do our job. And I'm very fortunate to work with a dedicated group of nurses and physicians that are showing up every day and doing everything that they can to make sure these patients get the best care. That being said, I don't think you'll find any healthcare system in the state of Michigan, and certainly not in Metro Detroit, that's not dealing with staffing challenges. We do the best we can. We're very nimble. I'm thankful for a group of operations leaders and nursing leaders who are looking outside of the system for ways to recruit more staff. That's something that we're always trying to do, but it is difficult. And especially as we look ahead to the prospect of a fourth surge that could last another 3 or 4 months, or take us through the winter, this is going to be a tough one. Every surge up to this point has had a little bit of a different flavor to it. This one, as I said, is shaping up to be a little bit more of a marathon than a sprint.